Welcome back to Cheddar's Opening Bell, everyone. Americans' trust in government agencies like the Centers for Disease Control and Prevention, as well as top health officials like Dr. Anthony Fauci, is rapidly dropping, particularly among Republicans. And for more on this, I'm joined by Dr. Richard Besser, former acting director of the CDC, currently the president and CEO of the Robert Wood Johnson Foundation. Doctor, it's great to have you with me today. What is the source of this eroding trust?
Well, one of the most powerful tools that you have at the CDC and you have in public health is trust, because early on in a public health crisis, what you don't know far exceeds what you do know, and you really count on people following the best guidance of experts. When there is concern that the recommendations that are coming from your public health leaders are being influenced unduly by politics, then that brings to question, are the recommendations based on the best available public health science, or are they being brought forward for other reasons? And repeatedly during this crisis, we've seen instances where the political sector has reached in and changed public health guidance from CDC. And that is a real problem. It's a real problem for people who work in public health, who look to CDC for the best guidance. And it's a real problem for the general public who wants to know what they can do to protect themselves, their families, and their communities.
We do see, according to Politico, that Democrats are going to be pushing back and investigating whether the CDC was used as a political means, whether or not the Trump administration did push back and try to alter some of the messaging coming from the CDC. What do you make of that?
Well, it's really important. There's incredibly important information coming out from the CDC every single day. Unfortunately, the CDC is not in a position where they're talking to the public through the media every day to be able to lift up that information. But if you look at a lot of CDC publications, there's great information there. The challenge is, if some of the information that's being put forward has been influenced politically and no longer represents the best recommendations of the agency, then people have to pick and choose and say, well, is this a guidance that's science-based, or is this one that's politically based? Are the interpretations here the best scientific interpretations or not? And that's not something that anyone, whether they have special skills in public health or general public, is readily able to do.
And it's interesting because the World Health Organization, doctor, has gotten pushback even since the early days of this virus, that they didn't broadcast enough that it was coming, the severity of it, how exactly it was spreading. Do you think that the World Health Organization did its job?
Well, the World Health Organization is critically important, and the idea that we would be stepping away from the global health organization at a time like this is really unconscionable. Did WHO and have they done everything correctly and as you would like? No, clearly not. And there's things to learn there. But most of their power comes from influence. They don't have authority over governments. And so they try and use their power of influence to get governments to do the right thing. Early on, some of the comments that came out of WHO regarding the situation in China have been shown to not be correct. But through their communication, they've owned up to that and stepped up. We need to be able to engage with them to ensure that the work they do is as strong as possible, because they count on governments, on public health professionals from around the globe to supplement their own resources to get the job done.
Was it a lack of resources, a lack of funding that could be blamed on this, that the World Health Organization didn't have the resources to make the right calls?
Yeah, I wouldn't put it all to that. It's going to be really important to get external review of WHO, just as you were talking about external review of government influence over CDC, to see, okay, what was, if there were some bad calls by WHO early on, why was that? Was it due to issues of their authorities? Was it due to misinformation? What was it, so you can learn from that and move forward? But it's not a time to reject the value of having a global health agency.
And a new poll, doctor, from your foundation and others finding that communities of color are being severely impacted by this pandemic. 72% of Latinos, 60% of Black families, and a majority of Native American households report financial hardships. Plus, at least 4 in 10 Latino, Black, and Native American households report using up all or most of their savings. Is the U.S. government doing enough to intervene on behalf of these communities?
Absolutely not. Our poll was taken from early July into early August, and that was at a time when people were still getting supplemental unemployment insurance checks, and there was still moratorium out there on evictions and mortgage foreclosure. We need to do more. What this poll is showing is that the communities that have been hit hardest in terms of health, hospitalizations, and deaths from COVID are being hit the hardest economically. And those $1,200 checks are long gone. The supplemental unemployment insurance is gone. A lot of the protections for eviction and mortgage foreclosure are gone. We need our political leaders to step up and help people across America who are truly suffering due to this pandemic.
Okay, we got to leave it there. Doctor, thank you so much for joining me today. That's Dr. Richard Besser. He's a former acting director of the CDC and currently the president and CEO of the Robert Wood Johnson Foundation.